But one thing that is being done by some countries, I think, in Rwanda, for instance, our higher education council just released a guideline on AI. So there needs to be certain guidelines to know how far can you go to use AI. I think another issue, especially on the faculty readiness, is there will be a fear of some lecturers of being replaced, or maybe not feeling like students are not doing their best. So there needs to be a reskill, like reskilling to teach with AI, not to compete against it, but mostly like enablement, trainings, like sprints for faculty to experiment. How can you also use AI as a driven teaching tool? Yes, but I also think on the equity part of and ethics, there are going to be some biases because our own stories are not in the systems. Our languages, our local languages are not in the systems. African health protocols might not be in some data sets. So the equity might not only come from the finance part, but also from the ethics of having Western biases in some of the responses that the chat box are replying to us. I don't know if you've tried it in your own language. I've tried, and it's terrible. So it's not at all. So then we need to also adapt it to our own languages and our African traditions or health protocols as well. Thank you.
Yeah, very, very important points that you have raised. Maybe Dr. Manipeni, if you can add to that, and also maybe you can also address the next question I had for you about the human-centered care. How much, as we focus on the mundane tasks being taken on by AI, students may risk losing the touch, with the human essence of medicine. Is this how much of this is actually a myth, and how much of this is a reality? And if so, how can we ensure that future healthcare professionals still master empathy, communication, and ethical judgment? Thank you.
Thanks, Prof. I think just to close off that previous discussion, I think if you had an image of ChatGPT, it would be me, I maybe talk with an American accent, but it would be me. And I think that's one of the things I would like to change. I think we need the large language models need to not look like me. They need to look like people who are from around here. I'm sitting here in Nairobi. That's what they need to look like. Or people in Nigeria or other places in the African continent. So, because the biases are inherently there. I remember looking at we had AI-based VR simulator, and you couldn't choose. They've changed it now with our feedback, which is great. But you couldn't choose to be an African man. You couldn't. That couldn't be your avatar. And they were like, "Don't worry about it. You can choose any color, any color." I'm like, "Well, yeah, I know I could, but." I think as an African man, I'd like to choose an African man, thanks, But moving on to the thing around ethics and humanism, and I think it's interesting actually because I can't remember it's popped into my head, but I can't remember where the studies come from. But there was a study, and maybe there's undoubtedly been more, where people preferred the ChatGPT or equivalent when they were talking to them over the human when they weren't aware who they were speaking to, because the ChatGPT was more empathetic. And I think that's something that we just have to be wary of. Certainly in my medical career, I think it was a bell-shaped curve in terms of my seniors and my colleagues as well. Most were in the middle. Some people very empathetic and very patient-centered, and some people like monsters, basically, psychopaths almost, throwing scalpels and all this kind of stuff, So I think in some ways, used well, AI can help, I think, actually, with this kind of stuff. People talked previously around the AI simulated patients. And I think one of the problems people sometimes have is they don't get enough opportunities as healthcare workers to have these conversations. You maybe practice a little bit with a friend, perhaps. Maybe it's in an OSCE, one of the objective exams, maybe. And then the first time you do it is maybe in real life when you have to go and counsel somebody that their parent has died or something. So I think AI actually, well circumscribed, can give you opportunities to have these conversations within AI, of course, but with supervision, et cetera, et cetera, et cetera, and various barriers and other things, safeguards built in. Actually, I think maybe this is what's missing at the moment. People are not given the opportunity to practice these conversations, and therefore they're not that good at them. So I think actually AI could help. And I think sometimes when people say one of the problems with ethics, and people don't realize that the thing that they're involved in is an ethical thing. So when someone, a drug manufacturer and says, "I'll give you this and you get this in return," maybe they think that sounds reasonable. I mean, there's nothing wrong with that. They don't realize it's an ethical thing because they've not had enough opportunities to look at that. So I think AI could help actually rather than hinder, to help us be more human. AI can, and again, in terms of offloading some of the stuff. So I know people talk about ambient AI, where AI is recording the conversation that you're having with your patient, let's say. But actually, one of the barriers often with a patient was that you're busy trying to write your notes, think about the diagnosis, do this, think about the next test, all this kind of stuff. And actually, if the AI can do that well, they can transcribe that stuff, that's a huge amount of workload off your mind, that then you can actually spend more time focusing and giving your personal attention to look out for those little nuances that patients sometimes give you, in terms of maybe there's something else that they've not quite told you yet.
Yeah,
thanks for the question.
That's very, very interesting perspective. You touched the main points that I raised, whether it is a myth or a reality. In the African context, where the ratio of patient to doctor is woefully, high, I don't think we can say that we have that humanistic element there. There was a case, I called a friend of mine back home, where he was supposed to have a procedure. When the day of the procedure, actually the doctor didn't show up because he was tied up with multiple similar procedures. So maybe, Mr. San, if you have a different perspective on this.
Oh, no, I don't. I totally agree. I really think AI is needed, especially with diagnostics, speeding up the processes. But then humans will still be humans. They still deliver the care of it, the whole point of it. Even I think I really had the similar point on communication. So if they can record and then after you analyze and you just have like a draft, even if you're doing meetings, you have a bot recording so that you don't need to rewrite and spend more time. So imagine if we have a ratio of 1 doctor to 4,000 people, imagine how many people they have to deal with. So I totally agree on that one, because I really believe it's not a competition. AI could never have the human empathy and care and connection and all that, but it will speed up diagnostics and actually improve on the empathy as well.
Yeah, thank you for your observation. Now moving on to policy and investment. This would be to you, Mr. San. Of course, a new technology like this one to be implemented, we need a robust government policy. So what role should policymakers play in establishing standardized AI competencies across healthcare education? And how do we address the digital divide between well-resourced and under-resourced institutions, especially in the African context?
Thank you so much. I really think then our government need to take the forefront on this one, especially with guiding principles on how are we using AI, being human-centered, inclusive, and so forth. So there is need of infrastructure. So making sure we have AI licensed tools that are integrated in our learning modules, in the health data security as well, making sure the module content is explicit. There's like AI use rules, because we talk about students plagiarizing, but we also don't look at also some of the professors when it's teaching health modules, but these are totally AI generated. So how do we make sure that there's AI literacy modules, guidelines on how much AI can you use, and also that they're tailored to the African continent as well. I also think we need some on staff readiness. So how, if we keep introducing new things then and overwhelming the staff, so there needs to be training, training for AI literacy, a pedagogy training on how to incorporate AI, health ethics, and so forth. Similar for students as well, they also need to be ready for the changes and new tools. And I think one more important thing is assessment. So what is permitted, what is not permitted, use AI use per assessment, the policies, governance around it. I think that would be the biggest part the government needs to work on. And as I shared already, we just received one from our Higher Education Council, and now it's going to be rolled out to the staff members to also start to use it. But also we need an equity funding model. So how do we make sure that all across all universities, medical universities, public health universities, they can access the open AI infrastructure, and so the government will need to direct some funding to that. Even all this that I just mentioned, guidelines, training, all this require monetary funding. So how do we make sure we use all these things? And I think, yeah, my point will be that policymakers shouldn't just regulate, like this is a rule, but maybe like also curate how can this be used, gather also feedback from young people. I think like innovation hubs on the African continent where universities can test and share AI models they're working on. I would say like we have so many now at school that sometimes I get overwhelmed, because every student is like, oh, I have an idea on how to do an AI model. So how do we take the ones that are really competing, and so that we stop working in silos and work as a system on the other, whether regionally or on the continent as well. Yeah, so I would say that would be my point on that.
Thanks for the fairly comprehensive response. We have, I think, 2 or 3 more minutes. Maybe we just go to the next question, and I would start with Dr. Manipeni, and then to you, Ms. Rosan. Let's look beyond the horizon and think of 10 years from now. What do you envision as the most transformative application of AI in healthcare education, and what steps must we take today to make that vision a reality? Dr. Manipeni.
Thanks, Prof. I think we try. I want to push it a bit wider, if possible. I think someone mentioned before, and people mention this often, that we need more doctors and nurses, which is kind of true, but kind of not true. We probably need more people who can look after people. They don't necessarily need to be doctors or nurses. And I think if we use healthcare education at the widest possible sense, then for me, healthcare education is education for healthcare for the population. So individual people know about their own health. They know to look up various symptoms. Maybe they get various alerts to tell them that this is, a good thing or a bad thing, etc.